Welcome to this video presentation of the approved changes for the Conference Health Plan for 2015. The Health Benefits Committee and the Conference Board of Pension and Health Benefits have been working to gain the best understanding of the Patient Protection and Affordable Care Act since its enactment in March 2010. Much assistance has been provided by Andy Hendren, Associate General Counsel at the General Board of Pension and Health Benefits, as well as much research and discussions within the conference and with our own consultants. With all of this information and comments from conference members and participants, the HBC and the board realized that changes would need to be made. With the employer mandate, which was to be effective in 2015, and the additional catalyst of petitions and amendments at the 2013 session of annual conference, changes to the conference health plan have been approved, along with the rates to be presented at Annual Conference 2014 in conjunction with our health care petition included within the CBO PHB report. This presentation will provide the summary of these changes and certain of the merits and considerations of this decision. More information regarding the guiding themes, processes, and rationale for this decision are contained within the report from the Conference Board of Pension and Health Benefits regarding the state of our health care plan for 2015, available on the conference website. Additionally, live question and answer sessions will be held at conference prior to the consideration of this petition and following annual conference should this be approved. On Friday, June 20th, the annual conference will be asked to consider the board's petition 2, Part 2, regarding the conference health benefits program and policies. This petition proposes, quote, that the Board of Pension and Health Benefits be authorized to secure a hospital medical insurance contract for 2015 that will be advantageous in terms of coverage, premium rates, and administrative costs, unquote. Due to the decision to make changes in the conference health benefits plan for 2015, you, the clergy and lay members of our annual conference, would benefit by understanding the components of what this plan will encompass effective January 1st, 2015. Based on the approval by the board, the Health Benefits Committee has directed the 2015 Conference Health Benefits Plan to include 3 new components. 1. To encompass 2 options for health care benefits for the participants, a basic plan and a basic plus plan. 2. To include a wellness program for the participants, and 3, to utilize a new pharmacy benefit manager for additional cost savings to our plan. With these changes, approved premium rates provide for a 26% savings for the basic plan in comparison to our current plan, and a 10.8% savings for the basic plus plan in comparison to our current plan. Cost sharing of these premiums by the pastors will increase if the participant chooses to enroll in the Basic Plus plan. That is the overview of the plan changes, but let's dive a little deeper into the details of these changes for better understanding. We'll start with the last 2 changes first. First, the Conference Health Plan will include a wellness program beginning January 1st, 2015. As many of you know, the Spirited Life program, sponsored by the Duke Endowment, is now in its final stages of intensive interaction with the participants. During this time, the sponsors of the program had requested that we make no changes to our plan so that their study results would not be altered. We have respected that request, but have now been released in order to include a wellness program for the coming year. At this time, we are continuing to develop incentive programs within this plan. These will be known and available after the Health Benefits Committee meeting in August 2014. Second, the Conference Health Plan, effective January 2015, will change pharmacy benefit managers, or PBMs. For a number of years, our conference has utilized Express Scripts, formerly known as Medco, as our primary PBM. In 2015, we will be contracting with PharmaVale, a company based in Atlanta, Georgia, founded in 2001 by 3 pharmacists, a PBM executive, a pharmacy school academician, and a large government group pharmacy plan consultant. With a wide network of pharmacies and mail order for ease of distribution, PharmaVale is currently working with several large organizations within our state, including SAS, Inc., located in Cary, North Carolina, and the UNC Healthcare System. In their proposal to us, PharmaVale performed a study of our current medical drug usage, noting the standard PBM margin which is included in each of our prescriptions. By providing a minimal change in our formulary and its pricing, the Conference Health Plan can achieve a savings of over $577,000 in our pharmaceutical costs on an annual basis. Lastly, the largest change in the Conference Health Plan provides options for the participants within the plan. This decision was the culmination of the research and knowledge attained regarding the Affordable Care Act and its far-reaching provisions. A number of options were reviewed. Maintenance of status quo with the aforementioned changes. Moving into a fully insured health care plan with other insurance carriers. Moving away from our self-insured plan and allowing participants to obtain their own coverage, and other structures which might be more cost-effective approach for the conference. We have already stated earlier in the presentation that the 2015 health plan would include two options for health care benefits, a basic plan and a basic plus plan. But how did we get there with a variety of items for consideration? Without going into a great deal of detail, let me provide a summary of some of the major points that caused these considered options to not be the ones selected. First, maintenance of the status quo was not deemed feasible for two distinct reasons. The communications from the participants and the local churches regarding the affordability of these plans, and the concerns for the financial vitality of each of our churches and the upcoming provisions of the Affordable Care Act, which would require us to pay penalties or taxes, as they have been labeled, for the maintenance of a Cadillac plan. This would require the conference to remit a significant amount of taxes of 40% of the difference between the value of our plan and a specified threshold determined by the IRS per participant. Second, proposals for moving into a fully insured plan with HealthFlex, the General Board's health plan, or with either of two other insurance carriers from which we requested quotes, was not deemed feasible, as the lowest quote received was 7.9% higher, and the highest quote was 54.3% higher than our own current health plan costs for the active participants. Third, moving away from our self-insured plan and allowing participants to obtain their own coverage required that amounts be paid by the local church to the pastor in order to provide these benefits to their appointed clergy. Under IRS regulations issued in the fall of 2013, these amounts would be considered taxable income to the pastor and would apply to all churches, not just those participants currently eligible for the health care plan. This income would be taxed under both income and self-employment taxes for the clergy persons, adding an extra burden to the clergy of our conference. Additionally, as all clergy would have to be treated equitably for compensation purposes and the appointment process, an extra financial burden would also fall to all local churches. Due to this plan was not considered feasible. After much discussion, the use of options within our health plan proved to be the most advantageous avenue. Under this plan, no coverage changes will be made within the plan. If a procedure or doctor visit is covered under our current plan, it will still be covered under either of the two plan options provided. The distinction between the two plans is purely the cost sharing of medical billings by the participants themselves. The Basic Plus plan continues the cost sharing through co-pays, deductibles, and out-of-pocket costs, as is included in our current 2014 plan. The Basic plan increases these. The table is provided within our report, and as you see before you, shows the differences between these items for each plan. To highlight just a few of the in-network changes, the basic plan will require a primary physician copay of $30 versus $15 in the Basic Plus plan. Deductibles under the Basic plan will increase to $1,500 from $1,000 in the Basic Plus plan. Overall out-of-pocket costs under the Basic plan will be $6,000 as compared to $3,000 under the Basic plan. But as we discuss out-of-pocket costs, I should also note, effective January 1st, 2014, your out-of-pocket costs now include medical copays in addition to your deductibles. Beginning in January 15, your pharmacy copays will also be included in your out-of-pocket costs. This will help to mitigate the increase in out-of-pocket costs, as additional charges which have been paid will now apply to this amount so that these are met more quickly than in prior years. Now, what everyone wants to know, the cost of the plan through its premium rates. The Health Benefits Committee approved the following rates for these plans, and these were affirmed by the board. A full listing of the rates by persons covered, employee, spouse, child, or family, is shown in a table within the report to annual conference and also shown before you. In looking only at the participant costs, the annual cost of the participant basic plan is $10,200, and for the Basic Plus plan is $12,300. The cost invoiced to the church for this coverage will be based on the basic plan, less the pastor's contribution based on his or her salary range as it is currently being computed. If the pastor chooses to enroll in the Basic Plus plan, the additional cost of the Basic Plus plan compared to the basic plan, or $2,100, will be borne by the pastor in addition to the pastor's contribution based on the sliding scale currently in place. The table you see before you and in our report includes an example of this cost sharing between the pastor and the local church and is based on the church whose pastor's compensation totals $50,000. In this example, of the annual cost of $10,200 for the basic plan, the church will be invoiced $9,792 annually, with the pastor contributing his or her share of $400. Based on these approved rates, the annual cost of the participant's plan under the basic plan is a reduction of $3,588 or 26% from the current plan. The annual cost of the participant's plan under the Basic Plus plan is a reduction of $1,488 or 10.8% from the current plan. With these changes, the board believes that the conference health plan for 2015 is one which is advantageous in terms of coverage, premium rates, and administrative costs. Not only is this plan providing for substantial reductions in premium costs for both participants and local churches, it provides options for the medical costs of the participants based upon their usage of the medical procedures and visits. By maintaining the self-insured conference health plan, we also maintain the connectionalism evident within our conference and continue caring for the pastors and their families, that providing the benefits for them and not requiring them to provide their own in an uncertain healthcare insurance marketplace. The Conference Board of Pension and Health Benefits hopes that you will also see the financial advantages including in this plan, while continuing to care for our pastors and their families by providing your approval of Petition 2, Part 2, Health Benefits Program and Policies on Friday, June 20th. As discussed at the beginning of this presentation, more detailed information is provided in our report to annual conference available on the conference website. Additionally, an information session will be held at annual conference on Thursday, June 19th in Stewart Auditorium, which is designed for our pastors, but laity are absolutely invited to attend. If you have other questions or concerns, please do not hesitate to send these to me via our conference website or via email to jburton@wncccumc.org. Thank you for your attention during this presentation. See you at annual conference in June.